So hello everyone, it's Matthew McKenzie here again. I raise awareness of unpaid carers, those that's caring for someone going through mental ill health or living with cancer. Um, I'm back doing my usual care activists, or I'd say not activists, but not only activists, but those trying to make a difference regarding lived experience and carers out in the community. So I've got Hannah here, Hannah Coddigan here with me today, and I'm gonna just go straight into this interviewing her. She does an awful lot of work in regards to lived experience nursing, but I won't take away her thunder in introducing herself. So Hannah, can you tell us a bit about yourself?
Hello, hi. I am a nurse who works in palliative care, but at the same time, I'm also somebody who has serious mental illness and has done a lot of work around the lived experience voice, and in that also how important the carer's voice is as well when we think of services that we provide in healthcare.
Brilliant stuff. And looking at in regards to support, what sort of support in your role do you provide carers and as far as lived experience as well, using your lived experience and what you went through and the support you got? What do you feel you could provide for
So
carers?
I think in my nursing role, so I work in a hospice. I think in that sense, the importance that I think not only are we looking after patients, we're looking after families, and we can also see how difficult it is when family members are unpaid carers and how hard that is, and how we give some respite to that work that is constant for people. I think from my lived experience role, I sat much more alongside carers in the mental health system as we sort of fought for things for patients. And it was really interesting just being in that sort of more collaborative co-production way of working with people, and just how important both the lived experience voice and the carer voice is for healthcare. And being on the other side of it, as a hospice nurse, I feel that there is actually more that can be done in terms of really establishing those voices in what I would say a kind of more macro level on how do we provide services for our patients. So I think there's a lot of work there for us.
And it's about engaging with those families and carers on in regards to how involved they are when they're supporting a loved one living with those conditions. In regards to your role, and you have quite a few, as long as I've known you, you've always been out in the field promoting, the importance of lived experience, especially in the nursing profession as well. So, in regards to your role, what are those challenges?
I think the challenge is that often there's a lot of time pressure. I think when people think of us looking after people, they often focus on the patient. They often don't focus on carers. And I think that when I look at my role, I see that as being part of my role. And I don't always know whether that is considered. And so then I think what we struggle with as nurses is the time sometimes carers need to be able to sit and say how things have been for them, how hard it's been, what things we can do that can try and help with that and the support of that. And so I think that in that holistic care of a patient, we should be thinking of the social situation, but I also feel that that is just not given the time that it's needed. And it's so important. I remember speaking to one carer, and she was, she's considered an unpaid carer, but actually she was a wife to her husband, and she just, wanted to be a wife, wanted those moments. And sometimes I think the caring role can take away those important moments for people, that they can be the brother or the sister or the daughter or the son or the husband or the wife, whatever people are to that person, how play a role as healthcare workers to sort of have some moments where we give respite to carers so that they can just be a husband and wife.
Brilliant. And that is true. I mean, we can't always just view the carer identity as just that in its most generic terms. It's a complicated definition for those who provide support unpaid for others, because that's how somebody would want to be known as, and they'll always sort of want to be known as in regards to their identity, what they find more meaningful, more special
Yeah.
regarding their relationship to the person who is the cared for. So regarding your role and your lived experience, what sort of future projects are you working on that can be aimed not only just at carers, but I suppose lived experience all around, both at those providing support and those needing support?
I think as my role as a band five nurse, I think it's just is that sort of advocating, that actually are we really considering the kind of carer's voice in terms of my nursing job? In terms of my lived experience, I'm actually part of a network, which is Healthcare Education Network for Co-Production. And that is being set up by Roehampton University. And that is very much to try and set some standards about how we kind of utilize the care and lived experience voice in terms of education, because I think that's sometimes where we need to start from. We need to start from people as soon as they're coming into the profession to realize how important both the lived experience and carer voice is. And how do we do that is in a way that is respectful? Because there's many carers that I've met, either often it can be hard actually when they're looking after somebody because of the time again element, but often it can be actually when somebody they then lost the person they were caring for, that they really want to educate from the journeys that they've had with their loved ones. And I think we need to open that space up, because I think there's a lot of learning that can come from both people who are going through it, but often they don't have the same amount of time, sadly, to people who've then lost people who then have more time to be able to then give to this kind of area of education. But actually, I think we haven't, I think there's more to do in terms of setting that up so that it feels respectful and values the voice of what is learned in that space of caring for a loved one.
Definitely, definitely. Final question. What advice, considering your lived experience and your role, would you want to offer those that are providing, forms of unpaid care?
I think for people who are going through it at the moment, and looking after people, find the support groups. They are so vital. Peer support is massive in terms of that understanding. They can just have that space for you to be really honest and to really talk about it. I would also encourage when, that even if nurses appear busy, not to feel like you can't approach nurses about how tough it is. These things need to be heard, and we need to hear it. So I'd encourage that kind of speaking. I think for people who have gone through the kind of unpaid carer role and then they've lost somebody, I would say at that point get support, because I think it becomes so much part of your life that it's really hard at that point when you've lost someone, and the support that's needed at that point. And then just to say your voice is of so much value. It really is a voice that really needs to be heard in healthcare, and not to feel like you shouldn't speak it, because it's so important that you do. And in the areas that you feel that you can share your story, it's of so much value.
Definitely, and I agree with that. There's so much value that can be had regarding lived experience, and also the involving cares, not only in forms of care, but in forms of co-production, system design, and co-promotion as well. Although I do think it sometimes takes a bit of confidence to approach, nurses that are rush off their feet to say
Yeah,
that
yeah,
you
it does. And asking advice again, I think that's where that peer support is really helpful,
yeah,
because I think asking the advice and finding out as well, because often there are in trust like carer champions, it's finding out the right questions to get sometimes to the right people. And it's often other people who are further down the kind of unpaid carer role who've picked up a lot of these things, get those kind of tips. But yes, you're right, it is difficult. And I think this is where, as healthcare, we need to do work in this area to ensure that we're hearing the voice of carers.
Thank you. Well, I'd like to say again, thanks for Hannah for taking the time to share her knowledge in regards to her lived experience and the importance of families and carers as well. So I'd like to say, see you again soon. We'll have another interview set up, and I'd like to say again for Hannah, thanks, and I'll see you again soon, especially on your projects. I look forward to supporting the stuff that you're doing.
Thank you.
So,